Reasons for snoring, risks and treatment. Millions of individuals snore on a regular basis, especially those who are overweight, struggle with breathing, or sleep on their backs. The vibration of the tissues in the airway, which often results from a partial blockage of the airway while sleeping, is what causes snoring. The following are some of the most typical reasons of snoring. Obesity. Having additional neck fat due to being overweight or obese can constrict the airway and result in snoring. Sleeping position. Snoring can be brought on by sleeping on one's back, since doing so can cause the tongue and soft tissues of the throat to fall back and block the airway. Age. People's throat muscles weaken with age, which can cause snoring. Sedatives and alcohol. Taking sedatives or alcohol before bed can relax the muscles in the throat, which can cause snoring. Nasal issues. Snoring may be brought on by nasal congestion or a deviated septum. Chronic snoring has health dangers in addition to the disruptive effects it has on the quality and quantity of sleep. These dangers consist of: persistent snoring might be an indication of sleep apnea, a dangerous sleep disease that disrupts breathing while you're asleep. Cardiovascular disease. Heart attacks and other cardiovascular conditions, such as high blood pressure, are made more likely by snoring. Stroke. Snoring has been linked to a higher risk of developing a stroke. Cognitive impairment. Prolonged snoring may cause memory loss and focus problems as well as cognitive impairment. Snoring can impair both the quality and amount of sleep, which can result in daytime drowsiness, irritation, and decreased productivity.